Life as we know it is changing dramatically, with the Prime Minister urging people to stay at home.
6 months ago, only a few of us had heard of COVID-19.
This is a disease that we are in our infancy of learning about.
Now it dominates our lives.
How worried should I be? You know a lot more about this than I do.
And medical science is struggling to catch up.
Every time we think we're starting to understand it, there's a new twist or turn.
Wow, it's not a pretty city.
I'm Chris Van Tulliken. I'm an infection doctor at University College Hospital in London, where I'm part of a team that studies and treats some of the world's most dangerous diseases.
The entry points for this virus is going to be your eyes, your nose and your mouth.
Now I'm being asked to return to frontline medicine for the first time in 10 years to help with the fight against COVID.
We all thought you were going to pass away.
I don't give up easily.
We have to just stay positive. We have to. It's the only thing that we have.
I want to understand what this virus is doing to our bodies and why it's so difficult to treat.
It is so malign in so many ways.
My twin brother Zand is also a doctor who's worked in disaster zones around the world. Now he wants to work with the most vulnerable here in the UK.
Are we shaking hands? Can I give you an elbow instead?
Oh, dare you
Oh,
say
no.
that to me?
As we experience the reality of this pandemic.
So how many people have you lost to coronavirus?
We lost 7 in about 11 days.
7?
We discover that even for those who survive, the long-term effects can be devastating.
My twin brother has been admitted to A&E.
I don't think many of us are catching this off our fruit and veg, but still.
I can't imagine that any medical professional in the country who wouldn't want to be involved in this. Because at moments like this, we're all potentially extremely useful. But I've spent a lot of the last 10 years making television programs and doing research in a lab, a long way from patients. Medicine is really complicated and you very quickly forget it, and that's what I feel nervous about.
Lyra, do you want to help me cook?
I also have a pregnant wife who's due in June. And going into a hospital where all the staff potentially and all the patients are possible sources of infection is frightening.
It's a bit nerve-wracking when you're the pregnant partner at home. But you're pretty careful, aren't you? How worried should I be? You know a lot more about this than I do.
My understanding is that you are not more likely to get severe disease than anyone else of your age, but you get it. It's really hard to put you on a ventilator when you're pregnant.
You must stay away from people.
We must at the moment, yeah. Why are we keeping away from other people?
Bad bugs.
Yeah, it's the bad bugs.
My twin brother Zand, who specialises in public health, is still recovering from his own encounter with COVID.
So I've had COVID, and I know what it's like firsthand. It was a pretty classic case. I just had a fever, loss of taste and smell, I felt awful, and I had a hacking cough. But there is this strange thing where I'm getting these irregular heartbeats. I'm getting runs of palpitations. And it's very weird. I don't know why it's happening. Having had the virus, I know how nasty it can be. So what I want to do is try and help organisations that are providing healthcare outside the hospital. Hey, how you doing?
Are you all right, Sandy?
Yeah, I'm all right. I live on my own. Normally, Chris and I would see each other almost every day.
How are you generally? Because I think my experience of this lockdown is very different to yours. Can't come and see you.
I can't see Mum and Dad. I can't sort of look forward to seeing other people.
That has been gradually getting me down.
Really?
How do you feel?
Going back to the wards, because you've been doing stuff, but you're a little out of practice.
It's a bit of an odd situation because it's a new virus and...
I think the real concern, this is killing young healthcare workers.
Really, nothing else we treat exposes us to that level of risk.
The UK is to remain under lockdown at least until next month in an attempt to contain the coronavirus outbreak.
Today, I'm going back to work on the wards for the first time in a decade. The best way to learn about COVID is by treating people who have the virus.
But the patients are sick and they're going to be there in huge numbers. It's nerve-wracking.
Anna has been embedded with the haematologist. We don't have an ITU person, so we could do with a volunteer of someone if we've got bodies.
I'm part of the infectious diseases team, and we're at the heart of the hospital's COVID response.
So it feels different.
It definitely feels different. We had to turn the theatres into an overflow intensive care unit, and we took over the
theatres there,
and now
is now
ICU. And then we've taken over the paediatric wards. We've turned those into COVID wards, trained up the paediatric nurses, and what used to be the stroke unit has now turned into the high dependency respiratory unit. So we really took over the whole hospital.
Hi, Leila. I can't give you a hug.
I know, virtual hug.
It's very nice
How
to see
are you?
I'm all right.
Before I can see any patients, I need to be trained how to use PPE.
So this is the gown. So you would put it on.
So surgical gown?
Yeah. The entry points for this virus is going to be your eyes, your nose and your mouth.
Your eyes?
Yes. It's highly transmissible and highly infectious, and they don't think you need much of a droplet before it can be transmitted to you.
I tell you what, by the time we've finished all this, my head is already hurting a bit and I'm extremely hot. So this is a very big change to the way we normally do business.
This is a very big change. As the pandemic has progressed, we've had to change and adapt the way we work continuously. We feel like we're on this hamster wheel that we can't get off at the moment.
Nearly all the usual business of the hospital has been suspended to create space for 180 COVID patients.
So apron, gloves, mask, visor, all on.
We're ready to go?
Let's go.
I've been assigned to a specialist ward where most of the patients are seriously ill, and the disease is throwing up some unexpected outcomes.
So I first saw Richard 8 days ago. He'd come in with his COVID infection. So that's him.
Oh, wow.
Normal lung should have air in it.
I mean, you don't have to be a radiologist
No.
to know that there should be more black here.
Yeah. His lungs continued to deteriorate. He was very unwell. He said, I know I am dying. But he sort of amazingly has turned the corner.
2 weeks ago, 80-year-old former taxi driver Richard was on end-of-life care.
I think it's one of the worst feelings I've ever experienced. That you can't breathe, you can't, breathlessness. I was at my lowest ebb, and I felt like I was going to lose the fight.
The virus is so infectious that the vast majority of COVID patients are not allowed to have any visitors.
What's it been like this whole time not being able to see your wife?
Not very pleasant. I speak to her every day on the phone. I'm looking forward to when we both home.
Richard.
How you doing?
I'm all right. You were starting on the breathing support and then you were stepped down for palliative care. You were very, very poorly a little while
Yes,
ago.
I was.
We all thought you were going to pass away.
I don't give up easily.
Can I have a quick look at you? OK, no problems there. Just look up for me, brother. Show me your teeth. They're pretty good, aren't they? They're still all yours.
Crazy, yeah?
Yeah. Just relax your head back.
To be honest, I feel really good.
With Richard, how is he even still alive?
I mean, it just seems like you get this huge inflammatory response in the lungs. And at some point, people are either it gets worse and worse and people are dying of that, or the regulation comes back and slowly that inflammation resolves.
Do you get surprised by people like him?
Everything's surprising. Every time we think we're starting to get a handle on it and starting to understand it, there's a new twist or turn.
People who are experts at this disease have only treated a few dozen patients over a few months. You know, this is a disease that we are in our infancy of learning about.
Ordinarily, the kind of environments that I work in, the emergencies, I'm the person from the outside. When the country that I go to, when their government can't cope, when there's a war on, I'm one of the doctors that would come in and try and make things better. And now we're in a situation where my country, my home, can't cope.
The impact of the coronavirus on care homes in England is becoming more apparent, with the new analysis suggesting the number of deaths could be double the figure already reported.
It's becoming clear that care homes are also struggling to cope with the virus. I've been invited to volunteer at a small care home in Peterborough, where they want to show me the challenges they're facing.
Good morning.
Good morning. I'm Alexander.
So, first of all, Zan, I'm just going to check your temperature.
Oh, cool.
34.4, so you're allowed in.
Great. Filia Lodge was one of the first homes in the country to suffer a major outbreak of COVID.
Staff wash their hands every 20 minutes. I'm going to test you now.
I'm singing Happy Birthday in my head.
It's looking good so far. Right, so you wash from the fingertips down to the wrist, and what you've just done is push the dirty water back over your was-clean hand.
Okay, yeah.
So if you can start again, please,
It's interesting just how ingrained, like I feel like I've been washing my hands a lot for the last few weeks.
If we don't do it to this level, that is how you are going to bring that virus into this home. Excuse me, chaps, can we just squeeze through?
Many of the home's elderly residents have dementia. Staff have to constantly monitor them to check for COVID symptoms.
Would you please go and do the temperatures of the residents and the staff that are on shift? You will need to report any of the residents are above 37.8.
Do everyone?
Everybody, every 2 hours. Okay.
You're checking everyone's temperature every 2 hours?
Every 2 hours.
Oh, nearly there. Bad shot. Give me another one.
Bernie, how are you?
Not too bad.
Would you mind if I took your temperature?
No.
35.9.
Where I live.
You're all right. Do you know how this works? I'm just going to put it on your head.
Oh, yeah.
Here we go. 36.7. We're happy.
What is that?
Is your temperature?
Yeah, is it good?
It's good. I mean, what's very noticeable to me doing this is that the idea that you could do any of this with any level of social distancing is impossible,
No.
right?
We would usually have our chairs right next to each other because some of the residents like next to each other, especially them two. But we had to separate that.
Oh. What's your name?
Margaret.
Margaret, it's lovely to meet you. Are we shaking hands? Can I give you an elbow instead?
Oh, dare you
Oh, no. Shortly after lockdown started, the virus got into the care home. Within a few days, many of the residents and staff were infected.
So we have got bedrooms over here. Some of them are empty, some of them are occupied.
Got quite a few empty bedrooms at the moment.
Yes, we do.
What's the most you normally have?
We are registered 20, which we did have before it all happened.
Okay.
And then obviously...
So are you running with fewer people because people have died because of coronavirus?
Yes.
So how many people have you lost to coronavirus?
In total, it was 7.
7?
Mainly that corridor. It was the people that I looked after since they come here. We lost 7 in about 11 days, 12 days period of time. Can we just stop for a minute?
Yeah.
Sorry.
They're not just a resident. They actually become sort of a surrogate family. And these people are dying painful deaths away from their family. You literally just had to support the person to pass as comfortably as you possibly could, telling them that their loved ones loved them. So, it's been difficult. The government gave us the lovely advice of care homes weren't at risk, very unlikely to catch coronavirus. So actually, when this all started, none of us knew what we were going to be dealing with.
And were you struggling to get PPE?
We did struggle. You couldn't go to your local authority at that stage and get masks because there just wasn't any.
How far ahead are you thinking?
24 hours. That's how I've lived my life now. 24-hour periods. Let's get through today, and then we'll see what happens tomorrow.
It seems amazing now that the government were literally saying care homes are low risk. More than a third of their residents have been wiped out in 2 weeks. They are deaths that shouldn't have happened. The people that are dying in that care home are literally the most vulnerable people in our society. It feels like there is an axe hanging over every care home in the UK.
At University College Hospital, we've more than doubled our critical care capacity. And as a result, we're just about coping with the number of new admissions. But I'm discovering that many of the patients being treated on our COVID wards are extremely complex.
So if we think about what's happening, you're still being fed through a tube going into your stomach. You're still needing oxygen. You only walked for the first time in well over a month yesterday, so your body is fragile. So the ward where I'm based, a lot of the patients who've come from intensive care, they have a very long road recovering from COVID and recovering from intensive care therapy. So vitals all heading in the right direction, oxygen's heading in the right direction.
He's had some bloods this morning.
Bloods this morning. Alison, how are you?
65-year-old community volunteer Alisan was transferred here from intensive care 6 days ago.
I hear that you've been very confused.
Alisan is so disoriented that his daughter has been allowed to visit to try and help his recovery.
He's been on drugs to keep him asleep, so the tube can be in his throat. He's been on painkillers. Those all make you very confused. But there's so much about this disease and its effects we don't know.
He feels very thirsty.
He can't drink yet. I'm going to give him some fluid in his veins, which will help him feel less thirsty. But in the meantime, I'm just going to dab this in his mouth, okay?
Okay.
So when you were in intensive care, the tubes in your mouth and the oxygen has really dried it out. Oh, look at this. It's so sore.
Oh,
it's so sore. The speech team couldn't see earlier. They said there was no movement of his tongue.
Yeah.
And now I can see very clearly his tongue is moving. When I press the liquid onto it, he's trying to swallow. So that's really, really a good sign.
Good sign.
He's steadily improving.
Good, that's good. I think he's
Is it
getting
hard,
better.
how are you doing? Is it hard for you to see him like this?
Yes, because my father normally very strong man. Yeah, he's very popular man in Turkish community.
Oh, really?
Everybody loves him. But now I see him like this, it hurts me.
Yeah.
It really hurts me. But he's my father and mom.
Oh, look at them. Amazing.
Yeah.
She showed me that picture of him on holiday with his wife. So hard to imagine that man there was this guy here a few months ago. He's disoriented, he's not quite sure of where he is, he doesn't know he's in a hospital at this point. Yeah, he's a long way from being completely right.
He's been off ICU now for 6 days.
Yeah.
He's had really big problems with delirium and confusion.
When we've been looking after these patients on the ward, I've been really astounded by how many of them have presented being confused, you know, hallucinating and being very disorientated. I had a patient who was admitted seeing lions and tigers and monkeys in her house. And I think that is most likely to be something causing swelling of the brain, and whether that is the direct effect of the virus itself on the lining of the brain or whether it is the immune system triggering something to affect the brain, it's unclear.
With so many patients coming from intensive care, I want to understand what's happening to them there when they're at their most unwell.
Is it just a bad lung infection, or is COVID different?
COVID is completely different than any other illness we've ever seen. It seems to do exactly the same harm, not just to your lungs, but to your heart, to your circulation, to your gut, to your kidneys, to your brain. It is so malign in so many ways. The degree of vulnerability that we feel in treating this illness is, I couldn't have believed that there could be a disease that would make us feel like this. We have to live with the fact that no matter what we do, there appears to be an immovable death rate with this illness.
Of what?
50%. Half of the people who come in die.
Intensive care is the busiest and most pressurised part of the hospital.
Great. Let's have a look at you. Okay, cool. My cool stuff as well, mate. Press. Let's go.
Inside, the risk of infection is so great that staff wear the highest level of PPE.
How's it going?
He's a bit skew-if, isn't he?
Not sure.
68-year-old restaurant owner Florentino has been on life support for 3 weeks after becoming seriously ill with COVID.
You can tell how unwell somebody is by standing at the bedside. Tino, he's got a lot of syringe drivers. We've got 3 types of sedative drugs.
He's stuck on a mechanical ventilator and on a dialysis machine. So without those 2 machines, he can't survive.
Up towards me, north, ready, steady, go. Lovely, thank you.
Hey, buddy, there you go. There you go.
This is the worst type of coronavirus that we see on the intensive care unit. Not only do we have a problem with his lungs, his heart is failing, his ability to keep his blood pressure up is failing, and his kidneys are failing.
Do you understand how COVID may have caused this?
Might well be his own immune system starting to attack his body in a way that started to try to protect it from a virus and now is turning in on itself.
He's a long way from that guy, isn't he? Bless him.
Florentino and his family run a Portuguese restaurant in North London.
This is the bar area in the restaurant, and this is my dad's location. So every time any customer would come in, my dad will be here. This is his spot. He's always up for having a laugh, and my dad's always got a different joke to tell. So I don't know where he finds these jokes, but he's always got a different joke to tell. And the customers just love coming in and speaking to him. Every day we're getting bad news, we're not getting good news. But I feel like I have to stay positive and I have to have hope. And I have to be strong as well, so my mum can be strong, so my brother can be strong, so my whole family can be strong. And we have to just stay positive, we have to. It's the only thing that we have.
Hi, Mama. His heart's in a funny rhythm. Fine. I'll call you when I'm done. Yeah. I'm gonna see him. I'm gonna see him now. I'm walking into a dirty area, so let me call you back. Okay, bye. So my twin brother has been admitted to A&E because his heart's in a funny rhythm. So I'm just gonna go and see him now.
I know Zon's had an irregular heartbeat since having COVID, but I wasn't expecting to see him in my own A&E.
That heart rate's a little fast.
Blood pressure's a bit low as well.
So what happened?
I woke up at 3 in the morning, was quite panicked. I went into this heart rhythm.
And then I started to just feel really, really, really ill. And then I was sick. So here I am.
So your heart rate's 170, but obviously you're lying in a hospital.
Yeah, it's like my heart's doing a marathon and I'm just sitting here doing nothing.
I'll give you a hug later.
It's safer for the staff around if we take you to a cubicle. And then we're going to do the procedure, okay?
The only way Zan's heart rhythm can be returned to normal is by giving him a huge electric shock that will stop his heart completely and allow it to restart naturally.
The anaesthetics team are going to give him an electric shock, like you see in the movies, where they restart the heart. It's like that, but you know, you're not entirely sure the heart's going to start again.
So what we're going to do is we're going to give you some medications, and once you're asleep, we're going to give you the shock, okay?
When you're a twin, we're not telepathic, but Zand is half my identity. I mean, there's no one I'm closer to.
How are you feeling there?
I had a glass of champagne.
Oh, very good.
Come on.
Just need a little bit. Everybody off, please. Hands off. Everybody step away. Charging. Okay, shocking. Everybody wait.
Oh,
delivered.
Fuck.
Heart's back in normal rhythm. Deep breath in and out. All done, sir. Standard rhythm. That's it. Now we just wait till he wakes up. And that was it. How are you feeling?
I wasn't expecting the flat line for quite so long afterwards. I guess you're used to it, but do you remember it, Zandy?
No, did I say anything embarrassing? I feel quite emotional.
Yeah, so do I. It wasn't very nice watching it being done. Isabel was very nice to me.
I feel like everyone's amazing and everyone's looked after me so nicely.
We're just doing our job.
Yeah, everyone's getting paid. Maybe it's not that big.
Are you alive?
Yeah. I'm feeling much better.
Phil Gothard is one of the most senior infectious diseases consultants in the hospital.
Do you think it is COVID related?
I just don't know the answer to that.
Okay.
We're in uncharted territory. I think we just don't know enough about the direct effects of the virus on heart function.
All right, Zandy. Well, I will actually get back to work,
good.
and
Yeah,
we'll see you later.
Thank you so much.
All right, see you later.
Cheers, Zandy. What do we know about what COVID does to the body? We know it's a lung infection, but
It's not just the lung tissue itself. When you begin to look at the small blood vessels in the lung tissue, there are lots of mini blood clots stopping oxygen transferring from the lungs into the bloodstream. Here he is coming into hospital with a condition in his heart which is not far from the lungs. And it makes us think, well, could he have had a series of small late blood clots that's led on to his heart problem? I'm sure people like Xander popping up all the time with this and that, and we're thinking, is this COVID? Is it just general illness? Is it their normal state? It will come out in the wash, I think. But at the moment, we're all scratching our heads a bit.
Phil taught me tropical medicine when I became an infection specialist. He was really one of my first sort of mentors. And to go to Phil and say, what's caused this? And for Phil to go, we don't know. That's not, for me, that's very unnerving.
But it sounds like it's a very real possibility my brother's heart condition has been caused by COVID.
Are you ready to go?
Yes, we've got some drugs for me to try and keep me in the normal rhythm.
Thank you, everybody.
You're all wonderful heroes. Thank you.
I got a real sense today of just how unpleasant it is being ill, how unpleasant it is having stuff done to you.
I can't go because I'm in scrubs.
Oh, you can't? That's it? That's the line?
That's it.
All right, well, thank you for looking after me.
All right, love you lots.
Love you.
I'm obviously anxious about it because every time it happens, then I have to come in and get defibrillated. Is it open? I just feel like frustrated and uncertain, and I feel apprehensive. If I knew it was going to keep happening, and I kind of knew when and all the triggers and everything, that would be a bit easier. But it's like it might be nothing, or it might be a thing that dogs me for years to come, and I don't like not knowing. Thanks.
The United Kingdom has outstripped Italy in the number of coronavirus deaths, becoming the worst affected country in Europe, with just under 29,500.
Please, my home. Hello. Hi.
Florentino has now been on a ventilator in intensive care for over a month, and there's little sign of progress.
Hello. Hello.
Okay, can you see him?
Yeah.
Oi, oi, tak je bent, lá.
Vai, tá tudo bem. Tá tudo bem,
Not being able to just be by my dad's side is the hardest thing.
Open your eyes.
For him to be in there on his own, it's just really heartbreaking.
Hey, things are not looking good for Tino, are they, at the moment?
The results of a recent CT scan could explain why Florentino is not improving.
Well, it's not a pretty CT, is it? Really?
Not at all. His lungs are very stiff now, very uncompliant.
The tissue of the lung, all those hundreds of thousands of little bubbles that aerate, fill up with air and close all the time, have become damaged, filled with fluid, sticky and full of inflammatory material.
Florentino barely has any healthy lung left. In almost 20 years of being a doctor, I've never seen lung damage like this.
What you're trying to do is buy people time and cause and limit harm. And we don't know. We could buy him infinite amounts of time now, and this degree of lung damage may not reverse. We don't know.
But so much of what we do can cause harm.
And what I don't want to do, and none of us want to do, is put him through that if there's no chance that he'll get there.
With Florentino's chances of recovery fading, Mike calls a meeting of senior consultants to decide whether or not they should continue with his care.
He's had COVID for about 6 weeks, probably.
So obviously he's in a difficult place.
So I think that he's a man who's on the verge of, really maybe not benefiting from the amount of treatment that he's having at the moment.
So despite best efforts, we've made a little bit of headway with his breathing, but not dramatically. We're not making as much progress as one would hope by this stage.
And that I think while we still have elements of his care that are, I'm trying to think of the best way to put this, because I think we're in a really tight spot with him,
So if you're thinking about the future in terms of benefit, harm, autonomy, I mean, I don't think it's completely futile. I think there is a chance for him to benefit. I think the odds are against him, but I don't feel confident that they're overwhelmingly against him.
So these conversations are hard, but we've decided as a team we think this is the way forward. He's in a bad way. It's going to be a real challenge to get it right for him. We just got to work really hard and hope for the best.
The hospital still has over 100 COVID patients, many of whom have been here for several weeks.
And once you get home, It's so depressing.
I know. And we want to get you home as well, Edwin.
This virus is so unpredictable that many of these patients could suddenly deteriorate at any time.
Is worse and not better. And I think that's what concerns us. There's not much functioning lung left.
There's currently no drug we can give to cure our patients.
We know that this COVID illness, can cause problems with the brain and problems with the nerves.
If they do get worse, there's sometimes very little we can do to help.
For the patient, it seems to be really more difficult, almost gasping.
Can we just go see him? Where is he?
But 18, he's in college.
Yeah. How are you?
I'm called in to see a 69-year-old man who's been with us for 6 weeks. He's so unwell that his wife has been allowed to visit.
She's very distressed. I think she just wants a bit of peace.
Yeah, just leave her for a little bit.
He took his last breath, but he was comfortable.
He was comfortable.
Well, Sydney, thank you. Sorry, that's not easy for anyone. So one of the patients who's been on the ward for a few weeks now has a very complicated medical history, then had very severe COVID on top of that. But none of us were expecting him to die today. They want to know if the children can see the body. I feel like that would be... Whose call is that?
That would have to be Chelsea or Laura.
Okay, well, I might have a chat with them. I mean, I was in the room for about 10 minutes, during which time I just had my finger discreetly just checking there was no pulse, no breathing effort. The wife was saying, you know, my children must see him. When can my children see him? And I couldn't answer. I don't know. I mean, I know they can't go to the mortuary. Can they come into the ward? I would think COVID will go on this death certificate. He's the first person I've seen die of COVID. And I feel quite affected by that. Partly because of the environment I come from. I'm not used to seeing people die so much anymore. He should have had 13, 14 more years of life. There are 3 young kids who will wake up tomorrow morning and they won't have their dad. They won't ever have their dad again.
It's been a week since I was admitted to A&E with a COVID-related heart problem, and I'm back at home, so I feel like I'm one of the lucky ones, but I still haven't fully recovered. I find I can get to the evening and sort of have achieved basically nothing, which I think is okay. I mean, the doctors have said I should do all the classic things for my heart, right? Exercise, diet, weight loss, all those things. But my main problem at the moment, I think, is that I'm anxious. If I take my pulse in the evening, it will clunk a bit. You know, it should just be... And now my pulse is, in the evenings, it'll sort of go... And then it'll go regular for a bit. Hello?
How are you feeling?
I'm all right. Things do feel a bit better, but I'm still getting a few runs of it here and there, so it hasn't gone away.
I know, I want everyone to be nice to me and feel sorry for me, but then I also feel really irritable and
like I don't want a load of hassle.
No, but I think you do need some rest. I mean, we don't really know, that sounds a bit unscientific, but there's nothing else that I can think of other than a bit of...
Good rest.
There's all sorts of interesting theories at work
be because the virus has interfered with the muscles, and that's what's causing the sort of muscle ache. But it also might be that the virus has interfered with the brain.
Yeah, I mean, I don't know about any of that. I don't know. I don't know.
What do you mean?
I think we've got. Look, man, I've got to go, and I've got to cook dinner and go to bed early.
All right, sorry, but I didn't mean to annoy you.
No, I'm not feeling annoyed with you. I just got to get on my. Sorry.
No, that's all right. Okay, all right. Well, look, I love you lots, and I'll call you later.
Okay, love you. Bye.
He's quite angry about it. He just got annoyed with me asking him a bunch of questions. I gotta go. I've got to have an early night. I've got to cook dinner. It's what was it, like 5 o'clock? He doesn't have to cook dinner. I need an early night. It's like, what are you talking about? He just didn't like me bothering him. He doesn't want to think about it. I think he's worried because no one can tell him what's going to happen. Right, should we pack this hospital bag?
How many nappies do we need to bring to hospital?
More than you think of the whole bag.
My wife Dinah is due to give birth in a few weeks.
There's still, I guess, a chance that I come home, I feel well, and I'm actually infectious with COVID. I find it very easy to cast my mind back to the way I felt about this like a month ago, which was this was a cold that could kill older people. And now it's really clear that this is a horrible, terrible virus that can affect every aspect of your life and body. I guess the thing is to get through the birth without getting it. That's the thing I've sort of slightly felt we've been good about. I think that's what I have to double down about. Giving birth is risky for everyone, but that risk of being ill with COVID would be really bad, I think. It's frightening.
Following the decision to continue with Florentino's care, his doctors believe a visit from his family is essential.
Lily, I'm sorry we've deprived you of your dad for so long.
Just be aware. My mum said she's going to shake him, so...
Having contact with loved ones can be vital for recovery, even when patients are unconscious.
The reason why we want you to be here today, because there's one thing us talking to him, but he doesn't know us.
Yeah.
And it's quite important. Underneath all the sedation, underneath this process, he will know that you guys are there with him. And that will be really, really important for him and for us, okay? So it is hard to see. He's plugged into a lot of machines. Underneath all of this, it's still him.
Yes.
All right? And it's
Nice.
really, really important for you to have that time with him. You know, you can hold his hand.
Okay.
You know, you can be there with him.
Sure.
We've got this other problem of trying to keep you guys safe.
Yeah, with the visor.
Yeah. So we will show you how to dress
Yeah.
so that you're safe.
Mm-hmm.
And then you can spend some time with him. So you're probably nervous and dying to get in there, right?
Yes.
It's 6 weeks since Denise and her mum have been allowed to visit Florentino.
Pai! Pai! Estás-nos a ouvir? Pai! Estás-nos a ouvir? Estás a dormir? Isto não é um sonho, estamos aqui, pai. Andas a sonhar, é? Estás a sonhar com a comida da mãe?
Aperta a mão. Aperta lá. Estás a nos ouvir? Aperta lá a minha mão. Vai. Aperta, está apertado.
Tá? Vês que tu estás-nos a ouvir, pai? Vês que tu estás-nos a ouvir?
Vai, anda, força.
Isto não é um sonho, sabes? Estamos aqui.
É verdade.
Não é para tu teres pena de ti, ouvis, pai? Tu tens de continuar a ter força. I was able to touch his face and touch his hand, and he squeezed my hand a little bit. He made some sad faces, some sad reactions. But it's good because he had a reaction. Yeah, it was a bit hard, but it was nice to see him. Yeah. I think he heard us. I feel like he was able to sense that his family was there. I think his colour looked really good.
Yeah, it looked better than I've seen it since last week. Yeah.
Yeah. So, yes.
Yeah.
Yes.
Our hope is that the treatment that he's had is starting to create a bit of resilience and that he is hopefully starting a recovery process. But he has a long way to go.
Hey man, how are you? I suppose it's this strange thing of that I'm well, like there's nothing wrong with me at the moment, but I feel worn out. I feel like I went to the gym yesterday and did a really hard session, or I feel sort of hungover, just feel a bit sluggish. And normally I think I run at a reasonably high energy level, and I do not feel like that at all at the moment. I'm out of breath when I go upstairs.
COVID has affected me in ways I'd never imagined it would. So I want to see if there are other people suffering from unexpected side effects of the virus. These are particularly elegant, Carol. I never get given anything this good. We've even got trim.
You've got trim.
It's smarter than yours.
Can I be really honest? It is one of the few larger sizes left.
All right. Well, you could have just said you were treating me with extra consideration. I've come to the St Pancras Rehabilitation Unit in North London, where they provide treatment and support for people recovering from serious illness. What proportion of people in the hospital are here because of something to do with COVID?
Over the 4 wards, 75–80% of patients are here because of COVID.
Really?
Yeah. Because of coronavirus, there's less predictability in relation to recovery.
It's strange, isn't it?
It is.
And what about are you getting sort of young people like my age in needing rehab, or is it mostly people who are a bit older?
We've got some people in their 40s here.
Post-COVID?
Post-COVID and post-stroke.
Have they had strokes related to COVID?
Yes.
Really push. Push. Good. And right.
49-year-old mental health support worker Chuck suffered a massive stroke 10 days after contracting coronavirus.
So Chuck's here. You can see which side it's affected, predominantly the left side. For someone who was completely fit and well, had no medical problems working, this is a big, big change.
Chuck, can I just ask, what's the story? What happened?
Couldn't walk initially. I had to learn how to walk.
Really?
Yeah, I felt top heavy. Whenever I stood up, I felt I was going to fall over.
How many weeks after the stroke are we now?
Probably 6 weeks.
It's a pretty typical time frame we're seeing with possible COVID-type strokes is about a week, at least a week after the initial respiratory illness.
So, Chucky, how are you feeling about all this?
Initially, I felt somewhat sad and despondent, but what kept me going, just the thought of getting better and going back to my little ones, my 2 babies at home.
Oh, that's them there.
Yeah.
It won't be long, you're making great progress, you're not far.
So that's what kept me going. Don't disappoint the kids. Fight with every might you have to make sure you go home and support them the best you can.
Well, I have to say, I think you're doing an amazing job. It's very, very impressive. Good luck.
Okay, thank you so much. Thanks.
Do you think there's a more specific relationship between COVID and having a stroke?
It's such a good question. Over the space of 2 weeks, we had 6 patients like Chuck. If I'm speaking from a purely clot doctor perspective, I think that initial phase of the infection then triggers off a second phase of inflammation and clotability and some of these other issues that we are seeing and that we are understanding. This is not just the UK. In Wuhan, they had a similar experience.
Have you ever seen anything like this before?
Not in the context of an infection and not with this consistency. I think we won't fully understand the impact for those COVID survivors and COVID stroke survivors till probably long after.
Why I'm so desperate to get home is that just before the COVID started, I lost my wife to breast cancer. My kids, they're desperate for me to come home. One thing that plays in the back of my mind is they haven't had time to grieve the loss of their mom. You know, I miss them a lot, you know. But I want to be there now to help them as much as possible. I just tell them it's all right, that Dad is finally back, you know. I can imagine what they're going through. They lost their mom and they can't see their dad. I know we'll get over it. You know, we're strong enough to get over it.
What I've seen today, I did find moving. My experience of the virus was sort of typical at first, and then it did something else weird to my heart, which I never expected to do, which it wasn't sort of meant to do. But then you're seeing people who are having strokes, and you're seeing people whose entire bodies have been destroyed, that's going to take months, maybe years to rebuild them. I guess that's something that I just hadn't grasped until I saw what was going on here.
It's a day of major change in England as lockdown restrictions continue to ease. After almost 3 months, all non-essential shops can open if they stick to safety measures.
Hello. Hi, Carol. Nice to meet you finally.
6 weeks since we last filmed with Florentino's family, they've been invited to visit him again.
Tambay! Esse Tambay!
Hello.
Estás com o melhor aspecto hoje, não, pai?
Florentino's condition has improved so much that he's been discharged from hospital and is now continuing his recovery at St Pancras Rehab Centre.
Carol, he wants to get up a little bit, is that okay? He wants to show us his progress.
So how's Tino done?
Yeah, he's done brilliantly. He has recovered quicker than we could ever have imagined, if I'm being completely honest with you.
Wow! Já viste?
How many people who are that sick managed to get out the door?
Of all the patients who were as sick as Tino, maybe one other person survived.
Wow.
So for everyone like Tino, many weren't as lucky as him.
Oh, yeah. Huh? He's ready to go home now.
Soon, I think, very soon.
Can you open the door, please?
You're well looked after at home.
Oh, yeah. Huh?
Yeah.
Why did Tino get better, but the guy who was identical in the bed next to him not survive? They seemed the same. It's really hard to understand.
E o senhor médico disse que ele não sabe como é que tu sobreviveste, pai.
Foi milagre.
Foi milagre. Agora daqui a nada já estás em casa.
Graças a Deus.
Hã?
Feels like we've come really to the end of the first peak of infection. It's easy to think that we've kind of coped. Like the hospital, you know, it's quite quiet. We're loosening lockdown now, might have a second wave. What have we learned? Is this a virus we can now tackle?
Nothing could be further from the truth. You just think, you know, how are we going to do this again? the damage it did to people, our patients and to us. So if you ask, how do I feel about a second wave? I just feel scared.
You give your sister a little kiss to see if you can stop her crying.
Last week, Chris and Dinah had a beautiful baby girl.
You're being a really good big sister, you know, Bug.
With lockdown easing, I'm now in a support bubble with Chris and his family, which means I can finally visit them.
Hey, Bug, open the door.
Hello! How you doing? Oh! It's very nice to see you. Are you all right?
Yeah.
Oh, good. All right. So how much sleep did you get last night?
It is at 5 hours, yeah.
Is it all right? So it's three years on. Have you forgotten it all? Do you remember how bad it was?
I don't remember anything. No, it's cute and it's nice. I feel like you should at least change your nappy while you're here. How are you feeling? You have this axe hanging over you of at any moment you might have to go to A&E.
Every evening, I can feel things aren't right. At some point in the day, I am symptomatic, probably every day. It still causes me anxiety. What if I'm doing this important thing and I go into the arrhythmia, and then in the long term, I think, well, what if it never goes away? What if it gets worse?
I really worry about you. How many Zans are there out there? Millions of people in this country have had this virus, and a very large number of them will have these complex, diverse side effects. It may not be their hearts, it may be their lungs, maybe their kidneys, could be their brains. We don't know what it's going to do to our bodies as individuals. This is far more dangerous than I thought it was going to be.
I love you. I'll see you soon.
Bye, Zandy. See you later. You know, as we come out of lockdown, we don't have really effective treatments. We don't have a vaccine. We don't really have a way of containing this in terms of tracking and tracing people. We are still so vulnerable to every aspect of this virus.